The signs that winter has arrived in Iowa City are all around. Leaves turning from their vibrant green to brown, lakes and ponds freezing over, and trees standing empty against the winter winds. While for some this time might bring great joy, for others these are signs of the hardest part of the year. Alex Rath, a student at the University of Iowa, is one of these people.
Hi, my name's Alex. I'm a junior at the University of Iowa, and I have seasonal affective disorder. I first suspected SAD around my senior year of high school, and then going to college probably progressed a little more, and I began to research into it, and then I sort of self-diagnosed myself.
Dr. Aubrey Kinney of the University of Iowa Counseling Services talks about seasonal affective disorder and how it's diagnosed.
Seasonal affective disorder, or SAD as it's commonly referred to, is a type of depression. It often occurs based on seasons, typically beginning in the fall and then lasting through the winter months. Spring and summer SAD does occur, but it happens less frequently and has slightly different symptoms than fall or winter SAD. In order to reach diagnosis for SAD, you have to experience and meet full criteria for symptoms of major depressive disorder that strictly coincide with specific seasons, and that has to happen for 2 years in order to meet that criteria for SAD.
It affects my social and academics because socially I'm more closed off now and my friends don't really know why, and it's hard to talk about it. And then academically I'm not progressing because I skip class a lot.
University Counseling Service is our campus counseling center that is a place where you can go to seek therapy. Cognitive behavioral therapy is one of the common treatments where we're working on trying to combat negative thoughts that come up with depressive symptoms, as well as relaxation techniques and visualization and something we call behavioral activation, which is essentially ways to find activities that are engaging and that you enjoy. Typically when people are feeling depressed, they pull back in and withdraw from activities and people. Behavioral activation helps re-engage with that to then try to help reduce some of those depressive symptoms. So going to see a therapist at University Counseling Services could help with that as well.
Recently, the university got this thing called a light box, which just projects light, and I sit in front of it or do things in front of it for about 30 minutes, and I usually see good results, and I feel a bit better about myself. A few things I do to combat SAD is light therapy, tanning, treating myself when I actually do go to class, or hanging out with friends always makes me happy.
If you or a friend believe you might be affected by seasonal affective disorder, please feel free to reach out to the University of Iowa Counseling Services to set up an appointment.